So I saw two patients earlier, husband and wife, both in their 80s, near enough 80s, mid to late 70s. Obviously, I will, most of my discussions about patients, I will try and be not too specific about, their ages and where they are, and just for, of course, patient confidentiality. um, so they both had COVID about 2 weeks ago. They are post-COVID. They're both coughing up phlegm, green, yellowy color, both feeling a little bit tired and reduced exercise tolerance. Otherwise, well, back to eating and drinking okay. So the difference between both of them, when you do saturations, they've got same saturation, 98%, 99%. So there's no concern, obvious concerns, but I'm talking about this so we can see the difference, how we do things differently. So the lady had reduced breath sounds in her left base, and no crackles, no wheeze, nothing. And because she's been coughing up phlegm, I think it's reasonable to give her antibiotics. I have, of course, discussed it with my GP colleagues and they agree with me. So treated her with amoxicillin for about 7 days, and hopefully this will solve her problem. Whereas her husband had crackles, bibasal crackles, as well as expiratory wheeze. He's never had asthma before, so he also got antibiotics, and then he also had prednisolone on top of it for 5 days, and hopefully this will solve his problem. Now, the reason for mentioning this, of course, again, it's my journey. I'll be sharing it with you as we go along, as we learn. The reason why steroids were used, because the difference there is wheeze, and lady had no wheeze and the guy had the wheeze. See you soon.